Good afternoon. My name is Gabriela Santa Eugenia, and I will be presenting my Capstone PowerPoint presentation among the stages of life affected by childhood trauma and domestic violence. So, this is a presentation just to understand the lifelong impact and the role of forensic psychology within childhood trauma and domestic violence. As you go through these bullet points for my introduction, you'll notice a few points that are super highlighted. So, child abuse and family violence are two major social problems that affect children and the whole society in general. Such negative events impact the emotional and psychological aspect of a person's development and can change their behavior, interpersonal relationships, and quality of life. Childhood trauma is a key determinant of mental health disorders, substance use, and problematic relationship patterns in adult life. It can also have long term impact on the individual's life, including education, employment, or other career paths. Yet, with appropriate input and counseling together with the trauma informed approaches, people can recover and escape the vicious cycle of violence. It is important to understand how childhood trauma affects people across the lifespan, and this presentation will touch on the ways in which forensic psychology comes into playing in diagnosing and treating these effects. Significance of the topic. This topic is important because childhood trauma and domestic violence are issues that have far reaching consequences that may be realized for many years later. Such experiences affect a person's emotional, cognitive, and social growth, which results in mental health issues, substance dependency, and problematic interpersonal relationships. It is crucial to recognize these effects as interventions from mental health workers, teachers, and policymakers can assist in preventing adverse effects. Thus, forensic psychology helps to diagnose and evaluate trauma, recommend treatment, and make legal decisions about the perpetrators and victims. Child abuse, therefore, should be identified early, appropriate intervention measures taken, and survivors receive trauma informed care. By attending to these issues, not only mental health is enhanced among individuals, but society and economy will reap the benefits through decreased criminal activities and the resulting healthy societies. Childhood trauma and domestic violence defined. So, childhood trauma refers to a wide range of negative experiences, including physical and psychological abuse, sexual abuse, neglect, and witnessing family malfunction. These experiences shape a child's brain development as well as emotional and social well being in the future. Intimate terrorism, which involves the use of violence in close relationships, is not only dangerous to the recipients but also to the children who are witnesses to the violence. Studies have shown that children who witness domestic violence are also affected as those who are directly abused by their fathers. This results to long-term psychological and behavioral effects. The consequences of childhood trauma are seen throughout adulthood, raising likelihood of mental illnesses, substance abuse, and perpetuating victimization, including by being abused or abusing other people. Knowledge and awareness of these definitions are critical for practicing interventions and prevention of trauma. So, psychological impact of early childhood, which is 0 to 5 years. The studies that have shown traumatic experiences in early childhood, specifically ages 0 to 5, can have a very deep impact on the psychological well-being of a child. Experts have noted that the brain goes through its substantial development in the course of this period, and experience of trauma can produce changes in the pathways in the brain, thus impacting on its cognitive and emotional development. Another is the disruption of secure base, which is hard for children to develop trusting relationships with people. These children also become prone to developing an extremely heightened sense of fear, which leads to hypervigilism, increased anxiety, and low levels of trust in others. There are also behavior problems, as many children acting aggressively or avoiding others due to their poor self-control, problem-solving skills. Further trauma also entails developmental repercussions. Children experience a challenge when it comes to social integration in daycare, preschool, and many more. These effects can be reduced through early childhood development and early childhood education and early childhood support care. Effects in adolescence 16 to 18 years. In their adolescent years, children who had been exposed to early trauma commence experiencing form of trauma impacts felt on their emotions, social interactions, and academic abilities. Youth who underwent childhood trauma are more prone to the development of mental illnesses, including anxiety, depression, and PTSD. Children raised by prostitutes may experience low self esteem, trust problems, and sometimes inability in interpersonal relationships due to fear of abandonment or rejection. Some of the youths indulge in risky behaviors such as substance abuse, self harm, or delinquency as a way of dealing with unsolved emotional pain. Effects in adolescents 16 to 18 years. It was also found that as children grow older, these effects of early traumas in their lives are more profound, which impacts their emotional, social, and academic well being. Children who have been exposed to trauma during their childhood are more likely to develop anxiety, depression, or PTSD. They are likely to have low self esteem, trust deficit, and other problems with interpersonal relationships, such as the fear of abandonment and rejection. Most resort to substance abuse, self mutilation, or delinquency to deal with emotional suffering, which is kind of what was presented in the last slide. Adulthood and long term consequences. Research has shown that CPT can have long lasting impacts in an individual's life across their developmental stages. Adults who were abused as children are likely to be mentally ill, and they may develop conditions such as PTSD, depression, or anxiety. These factors can lead to poor management of emotions, instability, and inability to perform some tasks. This system causes trust and attachment problems that do not allow one to build and maintain healthy relations. Moreover, people also seek solace in substance use to deal with PTSD and other types of trauma, which may affect their lives in various ways. Abusive women and men with records of childhood maltreatment are also at a higher risk of engaging in abusive relationships, thus contributing to the pattern cycle of abuse. Career stability is also likely to be affected due to the nature of the emotional disturbance that result from trauma. These may include poor concentration, relationship problems, and stress. These are long-term impacts that can only be treated through trauma-informed care and possibly lifelong support. The ACE study outcome. ACE stands for Adverse Childhood Experiences and is a groundbreaking study that seeks to determine the effects of childhood trauma on health psychology and relationships later in life. The study also indicated that those with higher ACE scores are likely to suffer from mental health disorders, substance abuse, and chronic diseases, including high blood pressure and diabetes. Moreover, there are adverse effects of childhood trauma, such as poor academic performance, which leads to low earnings and job insecurity in adulthood. The ACE study also brought to light that treatment should start early since most of these consequences can be prevented if the child receives help when young. This awareness has resulted in trauma-informed care, which is a concept that entails practices that seek to ensure that the impact of ACEs is recognized and clients are offered in an environment that empowers them to heal. These outcomes suggest that those working to improve public health, education, and criminal justice systems must recognize the role of trauma. The role of forensic psychology. Criminal profiling is instrumental to comprehending and responding to the effects of childhood trauma and domestic violence within the legal system. Forensic psychologists analyze the psychological state of a person who has experienced some form of trauma in order to help courts determine the level of harm and the individual has been caused and how this harm manifests itself. Psychologists give evidence in cases of child abuse, domestic violence, and criminal activities so that consideration can be given to the defendant's psychological state during court proceedings. Forensic psychologists assist in developing corrective and remedial programs for victims as well as offenders, focusing more on recovery. Their work also impacts decisions made in court on matters of sentencing, child custody, and protection of victims. Moreover, forensic psychologists actively participate in the development of research that underpins the policies that are meant to assist trauma victims and prevent re-victimization. They contribute to society by ensuring the fields of psychology and law work hand in hand in a way that brings about understanding and delivers more thoughtful justice concerning trauma. Intervention strategies in early childhood. It is important to note that early intervention in cases of childhood trauma is crucial in preventing long-term effects. Early intervention is vital in helping a child overcome many of the emotional and psychological issues she or he is likely to face. Trauma-informed parenting programs aim at ensuring that caregivers interact with the children in a way that fosters the child's sense of security and belonging, hence developing attachment. Interventions like play therapy and cognitive behavioral therapy help the children to act out their feelings while also being taught how to control these feelings in a healthy way. School and community agencies also help by providing protective context and nurturing that helps a child develop resilience. Further, Staying in the child's best interest, child welfare agencies and the legal system play a role in preventing further abuse by responding to reported cases and make sure that the child gets the needed assistance. Implementing these strategies in early childhood ensures that such individuals do not develop future mental health complications. Adolescent and adult intervention strategies. It is crucial that treatment interventions be implemented to help those transitioning from childhood to adolescent and then to adulthood. Mental health programs in schools are crucial to offer counseling, emotional support, and peer support for adolescents affected by trauma. CBT and EMDR are two examples of trauma focused therapies that assist people in working through their thoughts and emotions in order to find more effective ways to approach things. Together, support groups and mentorship programs help to prevent feelings of loneliness as individuals recognize that they are not alone and promote the ability to recover from setbacks. Legal activism is also important as this guarantees the victims of abuse get the appropriate protection and justice they deserve. Besides, employment and life skills training enable trauma victims to create positive change and become self-reliant in the society, thus enhancing their likelihood of recovery and overall well-being. To conclude, most survivors of childhood trauma and domestic violence need both psychological help and legal services along with the opportunity to acquire essential skills. Prevention strategies and policy development. Tackling childhood trauma and domestic violence requires intervention at several levels, including education, policy reform, and systems change. Awareness creates a response in the community. It educates people on the impacts of trauma and the need to seek help. Schools and workplaces can create policies that are sensitive to the effects of trauma to ensure that students and workers are protected. Child protection laws aim at guaranteeing vulnerable children and protecting our Child protection laws aim at guaranteeing vulnerable children are protected and have legal backing to receive adequate protection. Early detection and prevention programs that are adopted in schools and healthcare facilities assist in detecting trauma in children and adolescents for proper intervention. Also, the coordination between mental health care workers, schools, police, and social services is helpful because clients get a complete package of services. These procedures aim at combating childhood trauma and domestic violence, as well as supporting the healing process of those affected. Case studies and real-world applications. Analyzing genuine life scenarios helps comprehend the long-term adverse consequences of childhood trauma and the impact of interventions used. The outline case participants demonstrate psychological, emotional, and behavioral issues they encountered through their lifetime due to severe trauma. Other intervention measures like trauma-focused therapy and mentorship programs reveal that early childhood support can dramatically impact mental health. Forensic psychology is instrumental to addressing cases of abuse in a legal framework where it provides information necessary in determining the extent of the damage and the appropriate punishment or rehabilitation of the offender. The studies have illustrated that when survivors undergo care that is informed by the impacts of trauma, they can display significant enhancement in their feelings, interpersonal connections, and overall well-being. Learning from real-life scenarios, mental health practitioners, policymakers, and lawmakers can enhance the prevention of trauma, improve treatment interventions, and design policies that will benefit individuals who have been through traumatic experiences. Future direction in research and practice. Childhood trauma and domestic violence research and intervention for the future will be directed towards the accumulation and enhancement of information and treatment. Modern studies in neurology and psychology are gradually helping to uncover the after effect of trauma on the brain, leading to new forms of treatment. Further investigations of other approaches, including EMDR and CBT, should be conducted to fine-tune the method and enhance the efficiency of the treatments. Technology is also being used in the delivery of mental health care through the use of online therapy and mobile applications to enhance access to trauma treatment for the rural or the unprivileged. In the long run, the effectiveness of strategies that enhance the use of mental health services, especially for survivors of trauma, needs to be enhanced. In some, increased cooperation between forensic psychologists, legislators, and social workers implies improved understanding of how to handle trauma in a more comprehensive, coordinated, and efficient manner to prevent and treat such cases in the future. Conclusion. Childhood trauma and exposure to domestic violence significantly impact the individual's emotional, psychological, and social development. These experiences define a person from childhood to adulthood, increasing susceptibility to mental health disorders, substance abuse, and poor interpersonal relationships. Despite this, it is important to note that with proper early childhood care, intervention, as well as trauma sensitive practices, many of these unfavorable outcomes may be prevented. Trauma in forensic psychology is useful in treating victims and offering recommendations and decisions that involve crime victims and offenders. Community education, legal action, and mental health are crucial for putting an end to the cycle and designing conditions that will not allow abuse to take place in the future. Further research is needed, along with the nurturing of relevant policies and working cooperation between mental health practitioners, lawyers, and social workers to better address the situation and help those who have experienced trauma. Call to action. Thus, effective prevention and intervention of childhood trauma and domestic violence necessitate a coordinated and sustained community response. Supporting trauma informed practices in education systems, workplaces, and the criminal justice system means providing structures to support survivors in their healing journey. The increase in early intervention and enhanced mental health services can help identify and treat the effects of trauma before reaching a detrimental level. Stigmatization of people who have been through traumatic events is one of the biggest issues that need to be addressed, and educating communities about the trauma can go a long way in assisting people in need. It is also crucial that the survivors seek professional help as well as the available services like therapy, support groups, and legal services. Last but not the least, there is a need for further research and coordination among mental health practitioners, educators, and policymakers to enhance the current strategies for responding to trauma. Thus, future societies can avoid becoming perpetually entangled within the cycle of trauma and help establish healthier ways of functioning. So, here are some references that I used throughout the PowerPoint that can be